Hey everyone, Nurse Kat Pink here, coming to you to talk about wet and dirty newborn diapers. So, how do you know if your baby's getting enough to eat? Because especially when you're breastfeeding, you're putting your baby onto the breast, there's not a measuring cup on the breast that's gonna be like bloop, 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 baby drank 1 ounce, baby drank 3 ounces, right? So when you have a bottle, you can see how much the baby drinks, but when it's coming out of your chest mammary glands, not so much. So the purpose of this video is to explain something that's really simple and easy. Once you know it, and you're set for the first few days in the hospital or at home after you've had your baby for breastfeeding. How do you know if your breastfed baby's getting enough to eat? Short and sweet answer is the wet and dirty diapers. So if your baby is not eating enough, your baby's not gonna poop and pee enough. I'll give you the rule of thumb here. I made some cards because I haven't learned video editing yet. But basically day 1, and by day 1 I mean hours 04 to 24 after birth. So in the first 24 hours of your baby's life, you should see at least 1 poop. That's my drawing of a poop emoji. And 1 pee. This symbolizes urine. So in your baby's diaper, when you're changing it, or whoever's changing it in the first 24 hours, they're gonna be writing down how many poops and pees, because the nurses or whoever's taking care of you right after the baby, they want to make sure of this exact same thing. They want to make sure that the baby's pooping and peeing. I mean, the person who birthed the baby should be pooping and peeing too. They're going to track your poops and pees too, but we're not so much worried about mom getting enough. We're worried about baby getting enough. And as long as we see at least 1 poop in the first 24 hours of life, we know it's working, that the baby's from the mouth to the butt hole, all of that whole GI system's working like it should. Really the first poop is going to be really sticky and black, the meconium. The one exception to this rule of your baby maybe not pooping in the first 24 hours is if your baby pooped inside of you, inside of mom, or pooped on the way coming out of mom, which happens a lot, they're not going to have this first poop in the first 24 hours of life, possibly. So that's an important thing to note. The nurses taking care of you should know that. It should be in your chart where they've written down amniotic fluid was mec stained, meconium stained, because their nurses and doctors and midwives know when the baby's pooped inside. They can see it when your bag of water bursts. Let's say your bag of water burst at home, you came into the hospital, they couldn't find any leaking fluid to analyze, and for some reason they don't know if the baby pooped inside of you or not. If you feel like you want to have that conversation with your care providers, if they're saying your baby clearly isn't getting enough because the baby hasn't pooped and it's been 23 hours since the baby was born, if there's any chance that the baby's pooped inside of you or on the way out, it's a lot of squeezing when that baby comes out, and it does squeeze poop out, that's something you can bring up to them and just say, could it be that because the baby's already pooped? Okay, so in the baby's second 24 hours of life, so hours 24 to 48 after birth, that's what I mean by day 2. So that second 24-hour period, and so we're including a daytime and the nighttime, you want to see at least 2 poops and 2 pees. Do you see a pattern here? So day 1, it's 1 poop, 1 pee. Day 2, it's 2 poops, 2 pees. These poops are going to be looser. This is the actual milk is starting to come out of the baby's body. So the first poop and pee the baby had, that was just the amniotic fluid kind of stimulating the GI system to keep functioning. But now the baby's got a little bit of colostrum, of substance from your breast inside, and that's helping the poops and pees to increase a little bit. In day 1 and day 2, your baby's going to be losing weight. I'll make another video on that. No, every baby does lose weight in the first few days after birth. That's a separate topic. So day 2, you want to see 2 poops, 2 pees. Again, you should be writing this down in the log that the hospital gives you, or if you're at home, your midwife will leave you a log to write down poops and pees. And then can you guess how many poops and pees you want to see on day 3? You guessed it. Day 3, you want to see 3 poops and 3 pees. Yes, I am not an artist. Forgive me for the drawings of the poops and the pees. So 3 poops, 3 pees on day 3. 3, 3, 3. And this is not exact. This is an approximate of how many poops and pees you want to see. When you take your baby to the pediatrician to see their doctor on day 2 or day 3 of life, the doctor or nurse practitioner or PA that's seeing you is going to ask how many poops and pees has your baby had. and be prepared to pull out your log or your app or whatever you're writing it down on to tell them, hey, my baby's had at least this, excuse me, my baby's had at least this many poops and pees. Sorry, my phone fell down. Not quite at professional status. Okay, so 3 poops and 3 pees. And so what about after that? And so on. So how about day 4? What do you think day 4, so that 4th 24-hour period of life? If you guessed about 4 poops and 4 pees, you're right. That's approximately how many we want to see. And again, not an exact science. By day 3 or 4, the baby should stop losing weight and be at the point where it's flatlined and the weight starts coming up. So do attend your pediatrician appointments to make sure the baby is indeed getting enough to eat. And know that if your baby poops and pees more than this amount I'm giving you, that's good. That's great. That means your baby is getting plenty to eat. So no matter how much your baby wants to be at the breastfeeding, if they want to breastfeed all day, every day, and all day, all night, every night, know that that's normal as long as they're pooping and peeing according to this guideline. They're probably okay. So this guideline of day 1, 1 poop and 1 pee, day 2, 2 poops, 2 pees, day 3, 3 poops, 3 pees, you can think of that increasing guideline until around day 5 or 6. And here's where my handwriting gets I totally have a doctor's handwriting, even though I'm a nurse practitioner. But basically by day 5 and 6 and after, you want to get roughly 6 dirty diapers, 6 poop diapers every 24 hours. And you want to get roughly 3 to 4 wet diapers every 24 hours. So you could be changing that baby's diaper 10 times at least in every 24-hour period when you have a newborn. All they do is sleep, eat, poop, pee, a little bit of crying, lots of looking cute. That's just what the baby does. So hopefully that elucidates a little bit of something that's super simple, but a lot of nurses and doctors don't have time to explain, or perhaps it's hard to understand. And now these days with the mass trying to communicate between nurse and patient, or doctor, NP and the patient, midwife and patient, it's so hard when you don't have the rest of the face to look at, I feel like. So hopefully this kind of clarifies things that don't come through in your prenatal classes or when you're in the hospital after you've had your baby. So I will be making more videos about all the different nuances that go on with this. So this is just super, super basic. I'm sure it raises a lot of questions, but just to recap, day 1, 1 poop, 1 pee. Day 2, that baby should have 2 poops, 2 pees. Day 3, the baby should have 3 poops, 3 pees, and so on. Always talk to your baby's doctor or nurse practitioner if ever you're not sure. Make sure you hook up with a lactation consultant, so a nurse that's trained in lactation, breastfeeding, chest feeding, consulting. IBCLC is an international certification that those specialized nurses have, so look for those credentials. And make sure that you're getting as much help and support as you can. So hospital and doctor's office and private practice lactation consultants, depending on what resources you have. If you don't have as high of an income as you'd like, you might qualify for WIC, Women, Infant, Children, or similar programs that are government sponsored that provide lactation support services for free. There's many resources out there because it's not intuitive and it's not easy to feed at the breast. And when you're breastfeeding, you can't measure how much the baby's getting with ounces. You go by their wet and dirty diapers instead. So hopefully this tip helps for all of you out there. Again, Nurse Kat Pink here. Keep an eye out for more videos from me. I'll be making more women's health and lactation and gendered health videos, just bringing my experience as a nurse practitioner, a women's health hormone nurse practitioner, lactation consultant, and mom to you to kind of help make stuff that I wish I wish I had time with my patients to explain, but I just don't. That's not the way our system's set up. So I hope you enjoy these videos that are an attempt to simulate me sitting down with you and you getting a piece of my time as your provider to share with you these things that I think every patient should know when they have a baby. All right, so leave me a comment, and definitely if you like this, hit the like button and subscribe to my channel. I'll be posting at least weekly for years to come. So I'm hoping to really gain an audience so I can explain to people what I wish all my patients knew and what I don't have time to explain. So what your doctors never tell you because they don't have time. All right, y'all. Here's Kat Pink signing out. Lovely to see you.